Hi, this short video will take you through several of the structures that you can identify in this model of the human heart. To start with, down at the bottom there's this pointed part. That's the apex. At the top where you see all these large blood vessels coming out, that's the base of the heart. Here are some of the blood vessels that are coming out of the heart. This large blue one is called the pulmonary trunk, and it branches into the left and right pulmonary arteries. Those are heading towards the lungs. This one coming out of the heart, this red part moving up, that's the ascending aorta, and then this curve, that's the aortic arch. Over here on the right side of the heart, there's this big blue blood vessel, that's the superior vena cava, and then this one down here on the bottom, that's the inferior vena cava. So the heart has 4 different chambers in it, or 4 open spaces for blood to pass through. There are the 2 on the top and then the 2 on the bottom. The 2 on the top are called the atria, and there's a right atrium and a left atrium. And then the 2 on the bottom are the ventricles, the left ventricle and the right ventricle. So I want to take you through blood flow in the heart using some of those terms. So we're going to start with blood entering the heart by coming in through either the superior vena cava, it's coming from the top of the body, or anything above the heart. Things that are below the heart, though, they're going to send their blood into the heart through this blue tube on the bottom through the inferior vena cava. But either way, the blood's going to end up beginning in the heart with the right atrium. From the right atrium, blood's going to flow through this tube called the tricuspid valve. Through this valve, the tricuspid valve. From the tricuspid valve, blood will enter the right atrium, and then the right atrium contracts. It closes the tricuspid valve and opens this valve. This is a pulmonary valve. Blood is then pushed into the pulmonary trunk, the left and the right pulmonary artery, and then blood enters the lungs where it gains oxygen. That oxygen-rich blood comes back into the heart by coming in through these 4 pulmonary veins in the back of the heart. So you have the left pulmonary veins and the right pulmonary veins, and they're dumping their blood into the left atrium. From the left atrium, the blood moves through the bicuspid valve and into the left ventricle. When the left ventricle contracts, that closes the bicuspid valve and opens the aortic valve in here, so that blood can flow into the ascending aorta, the aortic arch, and then out to all of the body cells. So now that the heart is open, here are a couple of things that you can identify on the inside. You can identify these ridges of tissue. These are referred to as the trabecula carneae. Every once in a while you'll see that there's a long extension of a muscle. It almost looks like a fingertip, and that's attached to the string. These strings, they're representing strings of connective tissue called chordae tendineae. And those strings are going all the way from the valve down to this finger-like projection. That's called the papillary muscle. So papillary muscle, here's another one over here, papillary muscle. Then the strings, which are the chordae tendineae, and then the atrioventricular valve, or the AV valve. In this case, this is a mitral valve. This wall between the 2 ventricles is called the interventricular septum. Septum means wall. Interventricular, we're between the ventricles. The atria also has an interatrial septum, but you can't quite see it. But on the model, if you put your fingers in the left atrium and in the right atrium, kind of where they meet, right about there, deep in the heart, you would find the interatrial septum. If you look at the inside of the right atrium, you see these ridges. Those are called pectinate muscles. If you were to look at the same part of the left atrium, notice that that area is fairly smooth. You don't see those pectinate muscles there. If we put this back together, you can see some blood vessels that are coming off of the ascending aorta. There's the right coronary artery. And then over here, kind of behind the pulmonary trunk, you have the left coronary artery. And those arteries are going to supply the needs of the heart muscle itself. When the heart muscle is done with that blood, then it sends its oxygen-poor blood into this large blood vessel called the coronary sinus. Coronary referring to heart. Sinus means enlarged space. And that's a fairly large blood vessel. And that's going to bring blood back into the right atrium, where it can then circulate through the heart, out to the lungs, and then back into the heart before it supplies the cardiac muscle again. So those are some of the structures that you have to identify on the superficial part of the heart, as well as the structures deeper in the heart. Thanks for watching the video.